kin have been informed, but police say they're not treating her death as suspicious.
Doctors in Kent have developed a revolutionary technique that they hope which uses tiny bubbles to help detect breast cancer. The breakthrough at Maidstone Hospital could prevent tens of thousands of women from having to have 2 rounds of surgery.
Breast cancer is the most common cancer in the UK, with an average of 1 new diagnosis every 11 minutes. But improved treatment means 80% of women survive for at least 5 years after the cancer is first detected. Chrissy Reedy has the details.
Breast cancer spreads all of the breast.
For women diagnosed with breast cancer, the only way to effectively remove the cancerous cells is through surgery. Often, doctors recommend a second operation to be sure the cancer hasn't spread to the lymph nodes. Here at the breast cancer unit at Maidstone Hospital, they've come up with a revolutionary technique that avoids repeat surgery, using ultrasound and gas bubbles.
Now, it's important to know which is the sentinel lymph node preoperatively in patients with breast cancer, because that is the node which would contain malignant cells if breast cancer has spread out of the breast into the body.
Tiny bubbles of gas are injected into the nipple. Microbubbles then travel up the nymph channels. The sentinel gland is then highlighted. This is vital because should any cancer have left the breast tissue, this is where it will show up. The procedure takes 10 to 15 minutes and the results are back within 24 hours, avoiding a sometimes long and emotional waiting game.
So up front we can say, yes, it's a breast cancer, yes, there's a little bit of disease in the lymph nodes, so we need to do X. And they're positive about it, we know why we're doing it, and there's no sort of false hiccups on the way.
Now in remission, Beverly Wilson took part in the trials.
And I could see the bubbles travelling up and going into the lymph node. So I feel very privileged to have taken part in that, as I have a daughter, I have a sister and nieces, and I'm really glad that I was able to do my bit to help, and a positive came out of a very negative situation.
We want to provide the best possible cancer journey for our patients, and I think this will be a real improvement.
This revolutionary use of ultrasound pioneered here in Kent is a world first and could transform the way future cancer patients are cared for around the world. Chrissy Reedy, BBC South East Today, Maidstone.